Thank you very much. It's fantastic to be here. It's fantastic to see this huge crowd here tonight. And it shows the way our movement has grown, our movement to defend the NHS. I don't need to go over for you all the issues that we face. It's actually very sad, it's very bitter to say, I have to say, that all the things that we predicted 5 years ago have come true, are coming true. I remember giving talks about the perfect storm coming together, privatisation, the cuts, the impact of private finance initiative debts, everything coming together to actually bring the NHS to its knees. And that is what we're seeing today, whether we look at hospitals or primary care or community care or mental health, ambulance services, etc., right across the board. And you all know that. And what you've come, we're going to hear some more detail about some of those issues soon. But what you've come tonight about, I believe, is to think, how are we going to help to galvanise our forces for this big push that we need to make now to really fight for our NHS. Our fight to defend the NHS is the same in London as the same as the national fight. These are the same issues facing us everywhere. In London there are particular issues, and one of the great things we have in London is we have examples of successful campaigns like the St. Lewisham Hospital campaign. We've also got some very good working relationships across the city where we can support and learn from each other. And really the fight to defend the NHS is epitomised in those examples, whether it's the hospital closure campaigns, whether it's some of the fights that we've had against privatisation. In fact, in Lewisham we had a successful fight against the hospital wanted to outsource certain services to Serco, and our campaign succeeded in making company them to change their mind. So there are probably lots of other little examples around, but you don't always win it each time you fight, but you sometimes do. We've had health service workers on strike, and I'm sure that everybody here has been supportive of those workers, those frontline staff actually fighting, not just for their paying conditions, but unless we have good conditions, well-rewarded staff, the people who want to work in the NHS, we're not going to be able to sustain a healthy NHS. So that's part of the fight. We've had the fight to support trade unionists who've been speaking out in defence of their staff and who've been victimised. We've got Charlotte over there who've been fighting to help her support her campaign. There's a big campaign against the PFI in Barts, to get that renegotiated. So I think we've got examples around of our struggle, and that's not going to end. Whoever wins the election, those struggles are going to continue. But this is a very special time because it's an pre-election period, and I think we have to say, and this is I don't know whether everyone would agree, but I do think that the Tories are the number one enemy as far as I'm concerned. If they get re-elected, I think we will have to say goodbye to the NHS. I think that's what we would say. We'll have to fight very, very hard to defend it. It's good that we're going to have really be up against it. That doesn't mean to say that one puts all one's faith then in a potential Labour government. I think we have to remember what Labour started a lot of the privatisation. First people, government to privatise clinical services, and of course they embarked on the many disastrous PFI deals. So we have to also make demands on Labour too, but I think it's a different set of demands, a different set of expectations we would have. I'm a member of the National Health Action Party precisely because we don't think we can trust any of the main parties on the NHS, even though I do make a differentiation between them. I still think we need to have that independent voice as well, and that's why we have the National Health Action Party. However, what I found we discovered through the work of the St. Lewisham Hospital campaign is what you really need for this sort of, to defend the NHS and defend our services is what we call the United Front. We need to bring together all those who agree. I think there's more that we agree on than that we disagree on. I think that of course there are different opinions and there are different approaches, but let's not be divided, let's be united, and let's see if we can actually agree, everybody here, on a set of demands that we can make. These demands, I think, are ones that will help to sharpen our thinking, to clarify what it is that we think we need in order to defend the NHS into the future. They're educational in the sense that they raise the issues, and they also put politicians on notice that we know what's going on and we've got clear things we're demanding. So the demands that you see here are very clear. The first one is to repeal the Health and Social Care Act. That's so important because the Health and Social Care Act is not something that's over. You know, the King's Fund said it was a disaster, wasted billions. It was a big mistake. Even the Tories have said it was a big mistake, as if it's something that's almost ancient history. The Health and Social Care Act is happening now. The machinations, the changes, the complete chaos and disorder, the competition between different providers is actually what we're having to live and work within now as healthcare providers. And therefore, those who say, oh well, we can't have another top-down reorganisation, we just have to live with this act, are completely wrong. If something is so damaging and so bad, and still being bad and damaging, we need to get rid of it now. So I think repeal of the Health and Social Care Act is number one demand. But beyond that, also the privatisation, because even without the Health and Social Care Act, there was a certain quite a lot of privatisation. We need to halt that, we need to roll that back, we need to go back to a publicly provided health service. The other demand is about funding. There's a lot of rubbish spoken about how there's been an increase in funding. There hasn't been there's been flatline funding with about a 4% rise in our needs because of population changes and because of changes in healthcare technology. And therefore, if we don't have increased funding, we will not be able to sustain a modern healthcare system. We're going to end up in a situation eventually. I don't want to scaremonger, but I went to visit Greece and I've seen what extreme austerity can do to a health service in a modern European country, and it can bring it to its knees. So I do think we have to be aware that funding is a crucial demand. Now, £30 billion cuts to the NHS are predicted over the next 5 years. And Simon Stevens, who's the chief executive of the NHS, said that he expects governments to find 8 billion of that, but somehow the other 22 billion will come from efficiency savings. I don't know where he thinks those efficiency savings are going to come, because we've already had £20 billion of efficiency savings. We see how they manifest themselves in cuts, and that's why we saw the crisis in our hospitals this winter, the crisis in primary care, the crisis in mental health and community care. So I don't think we're going to survive with the £30 billion worth of cuts. Other issues, we do need to address the PFI issue. Barts is spending £43 million a year on servicing its PFI debt. We need to say to the Labour Party, you've got to address this. You've got to commit to renegotiating those PFI debts to fair value if you get into power, and has to be a very strong demand we make on them. We've got TTIP. You probably all know about TTIP, I don't want to go on about it, but it's a very, very important issue. I think we shouldn't just be calling for NHS exemption, because there's so much else about TTIP that's wrong, and actually impinge directly on health, whether it's to do with medicines, legislation around medication, or whether it's to do with food safety, or dangerous chemicals, environmental issues. All of them impact on health, all of them are covered by TTIP. So I think the only way we can deal with TTIP is to say we need to oppose the whole of it. And we need to end the A&E closures, the hospital closures. We have to call in a moratorium. All the arguments that they've made that we will put care in the community and we don't need hospitals are so spurious. First of all, they don't put the money and resources into the community. Secondly, there's no evidence at all. In fact, recent research from King's Fund and Nuffield and other quite mainstream organisations show that there's no evidence that putting more resources in the community actually reduces the need for our hospitals. Or cost less. Now, I really do believe we do need better community care. Anybody who's seen the 40% cut in district nurse numbers and how desperate this community care is could only welcome the idea that we need more investment. But the idea that that should be done in some way to justify closing our hospitals is just really, to me, wrong thinking, and it's really robbing Peter to pay Paul. We actually need to resource our hospitals properly and our community properly, and that's what we should be fighting for. We should say no more closures, cuts and closures of beds, A&Es, etc. Certainly not until we have fantastic community care which demonstrates that there's no need for so many hospital beds, which I personally doubt will ever happen. But that's what we should be demanding. So I think if we can bring our demands together, hopefully we can maybe find as much common ground as possible and not quibble over the differences, but unite our fight and focus. And I think that would be a great aim. One of the things that we need to do is we probably know a lot about the NHS, but we want to get it out to the wider public. So in Lewisham we've got this new campaign going, when you vote, think NHS. And if anybody would like to have some of these posters or anything, come to our stall at the the back, and we can put you in touch with how to get hold of these posters and stickers, just to get out to the public, to think about the NHS when they're voting. Thank you.
Thank you very much, Louise. As I was flying around getting ready for this morning,